Hi, everyone. I'm so happy you're here. Thank you for joining me today for this class. We're going to be talking about managing arthritis. And this is something that I see so much in my practice. And we're able to really address this disease dynamic from the viewpoint of looking at root causes, really solving those issues, and then the body is able to resolve the symptoms that clients are experiencing as a result of this disease process, right? So we're going to be talking about quite a few different types of related disease processes, processes that are related to have some of the same root causes as arthritis. So let me introduce myself if you don't know who I am. I'm Melissa Homner. I am the founder and lead coach at Sagebrush Wellness. We are a functional medicine coaching group that really, we provide specialized care to individuals who suffer from a wide variety of autoimmune and chronic illnesses. So our elite team of coaches provide service to clients all across the US via remote care. This is kind of developed because of COVID, but also because the type of care that we give, we have been able to serve clients all across the US, but also internationally, because we're able to do this very well by remote, via remote service. A lot of our stuff is done by Zoom. Our goal is to inspire, educate, and empower our clients to reverse their disease process and recover. So on this first slide, I give you a quick little blurb about that. And then if you want to book in for a free discovery call after this class, you're like, okay, I need to talk to this gal. I really need to understand how I can turn around my own life experience. Maybe you're suffering with arthritis. Maybe you're suffering with lupus. Maybe you're suffering with psoriatic arthritis or something like that. Those are disease processes that we have really great luck with. All right, so let's dig in. Welcome, welcome, welcome. If you have any questions during our time together, the best way to get those answered would be to actually email me directly. That email address is sagebrushwellness@gmail.com. And I love questions. I spend quite a bit of time each day answering questions for folks because I feel like that's the best way we learn, right? If you have questions and they're not being answered, send them to me and I'll do my best to answer those for you. Before we get started, I really want to understand that when we talk about a disease process that has a name, like a diagnosis name, that the underlying cause of that disease process may be the same as other disease processes. For example, rheumatoid arthritis, psoriatic arthritis, and osteoarthritis have the same root causes. There's just a little bit of variation in how it shows up for each person, right? So things like fibromyalgia, that is a diagnosis that is literally a collection of symptoms that present in a certain way and are compiled under the diagnosis name of fibromyalgia. Some of the same root causes for arthritis are the same for fibromyalgia. So as we talk through this today, you're going to get a picture of the fact that our bodies are they're intricate, yes, but the body systems that we're going to be talking about today, if those body systems are working how they are supposed to, these disease processes can be resolved. And I know that's not a popular belief among a lot of other health professionals, but this is what we have been able to understand and been able to help our clients achieve. Okay, so let's have some clarity. What is arthritis? So arthritis is not a single disease, but a term referring to various conditions of joint pain or joint diseases. Remember what I just said about the root causes for a wide variety of disease processes being the same or very similar. Okay, so arthritis affects people of all ages, genders, and race, and is the leading cause of disability in America, as more than 50 million adults and 300,000 children have some type of arthritis. Those numbers just stagger me. I'm like, oh my goodness. Because arthritis is something that is very easy to, I don't want to say easy because that's a relative term, but it's fairly simple to unravel this disease process in the body and really allow the body to then begin to recover. There are actually over 100 types of arthritis and related conditions listed in, listed as diagnoses. The most common types and the ones we're going to talk about today are osteoarthritis, rheumatoid arthritis, psoriatic arthritis, fibromyalgia, gout, and lupus. So let's talk about osteoarthritis first. This is a degenerative type of arthritis. It's also the most common form. But what happens is the cartilage, which is a firm, slippery tissue that supports the smooth joint motion, this protective cartilage on the ends of the bones wears down over time, leaving the bone rubbing on bone. People who are on their feet a lot, like for their job, or they do a lot of, like runners have, this can be common with people who do a lot of running if they're not taking care of their bodies. But osteoarthritis can damage any joint in the body. However, joints in the hands, knees, hips, and spine are the most frequently affected. So the most common symptoms which develop over a long period of time are pain in the joint during movement, joint tenderness when pressure is applied, stiffness following periods of inactivity, loss of range of motion, the grating sensation with the use of the joint, bone spurs that can form around the affected joint. And common risk factors are age, of course. Women are more likely than men to develop the condition. Carrying extra body weight stresses the joints and stresses the cartilage. Sports injuries, this is a big one, especially when we see clients who did a lot of sports, like in high school or college, and they had some pretty serious injuries or very, very intense sports they were in. By the time they get into their 30s, 40s, certainly by 50s, are beginning to feel that, right? And certain occupations with repetitive stress on the joint. So pain is commonly associated with the loss of cartilage causing the bone to rub against bone. However, there are other conditions that may cause this pain. So bone microfractures occur when the cartilage is lost, placing stress on the bone resulting in bone bruises or tiny fractures. Bone spurs are small bony growths that can occur on the sides of the joints. Joints are lined with a membrane or a liquid called synovial fluid to help joints move really smooth. And when this lining becomes inflamed, too much fluid can build up, leading to like an inflammatory response. Like you'll see, the joints will become a little inflamed, and kind of like if you push on the tissue, you can tell that there's fluid in there. So ligaments are bands. Let's see, I missed one. Joint pain often leads to being more inactive, which leads to muscle weakness, right? If it hurts to move, you don't want to move. Then muscle weakness will place additional stress on the joints. Ligaments are bands of tissue connecting the bones together. Damage to the ligaments is also common with osteoarthritis. We see this back again to, young folks that had some injuries when they were in, college, high school, or college sports. All right, let's talk about rheumatoid arthritis. This is something I see so much in my practice. So rheumatoid arthritis is an autoimmune disorder or disease process where the immune system becomes dysregulated, which results in chronic inflammation. This form of arthritis affects more than just joints, as it can also damage other systems of the body, such as the skin, eyes, lungs, heart, and blood vessels. And to speak very simply, this is generally caused by the liver and gallbladder combination not working well and being able to get rid of toxins and process them through. Often people who have rheumatoid arthritis have earlier in their life had their gallbladder removed. So this is a huge clue to let us know that, you know, this is part of the upstream cause for this person. And there's so many workarounds. There's so many things that we can do to really support the body's ability to work correctly, right? Food sensitivities are a piece of the immune system dysregulation because of hyperpermeable lining of the small intestine, right? I see this so much. There are also several specific strains of pathogenic bacteria in the gut that is directly responsible for this disease dynamic. The disease typically starts in small joints such as fingers and toes and progresses to the wrists, knees, ankles, elbows, hips, and shoulders. So symptoms generally occur in the same joints on both sides of the body and include tender, warm, swollen joints, joint stiffness that is usually worse in the mornings or after inactivity, fatigue, fever, and weight loss or weight gain. Some things to keep in mind are that women are more likely to develop the condition than men. It can occur at any age, but most commonly between the ages of 40 and 60. Excuse me. Smoking increases the risk and disease severity. Environmental exposure such as asbestos or silica may increase the risk, and obesity, excuse me, because of the extra strain that it puts on the joint, can also increase the risk. All right, let's talk about psoriatic arthritis for a minute. This is something that is a little more multifaceted. But psoriatic arthritis is an autoimmune inflammatory disease that affects some people who have psoriasis. Just as a little plug here, some of the same root causes that psoriasis stems from are also the same root causes that arthritis, just basic arthritis, can stem from. So it is an autoimmune inflammatory disease, and the dysregulated immune response leads to inflammation in the joints, in addition to the overproduction of skin cells. As with rheumatoid arthritis, this is generally caused by the gallbladder-liver combo not working well and getting rid of toxins. Food sensitivities are a piece of the immune system dysregulation because of hyperpermeable lining of the small intestine. There are also several specific strains of pathogenic bacteria in the gut that are responsible for this disease dynamic. Additionally, there may be a parasitic infection that can show up with psoriasis. When we create balance in the gut by eliminating what is harming the body and bring in the support that the body needs and prioritize an environment of healing, this disease process goes into long-term remission. Okay, so I want to talk about fibromyalgia really quick. So fibromyalgia is something that when people hear that word, sometimes their heart just kind of goes really cold because it is considered something that you can never come back from. And I just want you to know right now that we have had clients be able to achieve long-term remission from fibromyalgia. But because it is so multifaceted, it takes a while to kind of peel it apart and really address all of the root causes. So when I talk to somebody about coming on board and working with a coach, and this individual has fibromyalgia, I like to set the expectation that it's going to take a while, and it may take up to a year or over a year to really allow the body to completely heal, like go into long-term remission. So I just want to kind of set that expectation for you up front, but also let you know that this is something that is completely can be addressed, and your body can really improve. And we've had some really great results for folks who suffer with this disease dynamic. So fibromyalgia is considered a central pain syndrome, meaning the brain and spinal cord process pain signals differently. Researchers propose that fibromyalgia magnifies pain sensations by affecting the way your brain processes pain signals. I agree with some of this, but that is the research that is out there today. What we do here at Sagebrush Wellness is a little bit advanced for our time, I think. So other symptoms common among fibromyalgia sufferers include tension headaches, TMJ, which is this word is always hard for me, temporomandibular joint disorders. I like to say TMJ because it's easier. Irritable bowel syndrome, anxiety, and depression. Symptoms can gradually accumulate or have a triggering event such as a physical trauma, emotional trauma, surgery, infection, or very significant physiological stress that happened early on in life and has not stopped, or at least the body hasn't understood that it stopped. So some symptoms include widespread pain, such as a constant ache that lasts for months at a time on both sides of the body and both below and above the waist. Fatigue is a major symptom, feeling tired even after a long sleep period, like you just can't get enough rest. Cognitive difficulties that impair the ability to focus or pay attention to mental tasks. So things to keep in mind. This affects more women than men, and there's a higher risk when there is a family history of rheumatoid arthritis or fibromyalgia. Other disorders such as osteoarthritis, rheumatoid arthritis, or lupus can increase the risk of ending up with fibromyalgia. So as we're working with any of these disease processes, we systematically break down what is causing it, right? So we really break it apart. It's almost like I heard somebody say, it's like peeling an onion. And I really liked that analogy because you start on the outside. Let's start with what we can see readily. And then sometimes we need to move to some deeper type of testing. And we just address each issue as it comes up. And little by little, the body is able to then begin to be in a place of recovery, okay? So I want to talk about symptoms. Symptoms, sometimes we get really angry at them because they affect our ability to do life, right? And in all reality, a symptom or a group of symptoms are messages from your body. They are clues. Your body needs help, and we need to stop and listen and pay attention and see what is causing the symptom, why your body is really asking for help, right? So I like to just, instead of getting mad and frustrated and angry, really be thankful for those symptoms and just turn around and dive into, what is causing this for my body, and how can I really address this for myself? Our body systems are so strong, and when they're supported strategically, they can recover. And I want you to hold that close in your heart, okay? So let's talk about gout. This is a common and complex form of arthritis, but it does not cause body-wide inflammation. Excuse me. Wow, I've got a frog in my throat today. So gout can be characterized by sudden severe attacks of pain, swelling, redness, and tenderness in the joints, most often the joint at the base of the big toe. So I could go into all the science behind why that all happens. But gout results from the accumulation of urate crystals when the body produces too much uric acid or cannot remove the excess uric acid fast enough. And that the second, the inability of the body to remove the excess fast enough is what I see most often. So uric acid is a product from the breakdown of purines, which are found in foods such as steak, organ meats, seafood, and alcoholic beverages. I also want to say that sugar, just plain sugar, and insulin resistance is also a big piece of this. Uric acid normally dissolves in blood and passes through the kidneys to be excreted through the urine. This process, like the dissolving process, and the metabolic change of that so that it can actually be processed throughout of the liver, out of the kidneys, that process happens in the liver. So when this process is disrupted, uric acid can build up, forming sharp, needle-like urate crystals in a joint or surrounding tissue that cause pain, inflammation, and swelling. Symptoms can occur suddenly, often at night, and include intense joint pain, usually in the big toe, ankles, knees, elbows, wrists, or fingers, like the joints of the fingers. The pain is most severe within the first 12 hours. However, the discomfort can last for up to weeks later. Inflammation or redness in the affected joints can be another symptom, and it can cause a limited range of motion. So I touched on this already a little bit, but some of the risk factors can include, this can occur more frequently in men or post-menopausal gals, a diet rich in meat, seafood, and drinking beverages sweetened with fruit sugar, fructose, or sugar can be a root cause. This is a total clue that the liver is not functioning well and needs support, right? Obesity can also be something that can contribute. And untreated high blood pressure and chronic conditions such as diabetes, metabolic syndrome, and heart and kidney diseases. So when I say untreated, these are all conditions that kind of can come on slowly. And they're all conditions that are created as a result of lifestyle choices. So just knowing that you have the power to change this for yourself, I think that's really big. All right, let's talk about lupus. This is another one that I see a lot in my practice. So lupus is a systemic autoimmune disease where inflammation can affect many different body systems, including your joints, skin, kidneys, blood cells, brain, heart, and lungs. Lupus symptoms mimic other ailments, making it difficult to diagnose, and no two cases are exactly alike. The most common signs include fatigue, fever, joint pain, stiffness, and swelling, a butterfly-shaped rash on the face that covers the cheeks and the bridge of the nose, or rashes elsewhere on the body, skin lesions that appear or worsen with sun exposure, fingers and toes that turn white or blue when exposed to cold or during stressful periods. This is what is referred to as Raynaud's. Shortness of breath, chest pain, dry eyes, headaches, confusion, and memory loss. So let's talk about something, this is the real meat of this discussion today. So to treat arthritis, we need to first look at the gut. And what we do here at Sage Rich Wellness is so much more focused and, like I was saying, a little bit more advanced than most other health coaches and even some other physicians who deal with these processes, right? So for each of these disease processes we have talked about today, they can be put into sustainable remission without medications. And I want to talk to you about something that I've created very specifically to deal with the disease processes we talked about today. So it's a 12-week group coaching program. It's called the Whole Body Rejuvenation. Enrollment is actually open right now. So if you want to join this group, I'd be more than happy to have you. We'll be really working on the root causes that we've talked about today for these disease processes. I've had clients who have used this process with sustainable remission, something that they never thought would be possible for them. And one of the things that's really important to us here at Sagebrush Wellness is that not only do we want to teach you and lead you and support you as you become well, like teach you how to be well and then help you get there, but we want you to have all the tools you need to stay well, right? It's one thing to get well, it's another thing to stay well. And that's one of the things we really work hard on for you, is to help you stay well. So if you want to join us, go to sagebrushwellness.com and click on the 12-week program button at the top. You can sign up there. So we look beyond symptoms to uncover and reveal the root cause. So conventional treatment relies largely on pain relieving, non-steroidal or steroidal anti-inflammatory drugs, or NSAIDs, things like Advil, Tylenol, ibuprofen. These disrupt the gut microbiome in a big way. So for some individuals, even one dose of ibuprofen or Advil can cause lasting damage. So I'm going to get a little technical on you here, so just be ready. Some studies have found depleted levels of Homeophilus species of bacteria and an overabundance of Lactobacillus salivarius to really be part of the root cause. And I can agree with this. Inflammation can be aggravated by the overgrowth of pathogenic bacteria or a lack of immune modulating commensal bacteria, or bacteria that's supposed to be in our gut, right? So there are other bacterias, I won't dig into those, that are directly, they are directly related or root causes of these disease dynamics, especially things like rheumatoid, psoriatic, and fibromyalgia. So my favorite test for checking out what is going on in the microbiome is the GI map. This is a stool test to understand more fully the actual pathogens, to see if there's parasitic issues, to see what the viral load is, to actually test and see what the immune response is in the gut. We can also check for leaky gut or, hyperpermeability. We're able to see if there is endemic bacteria or bacteria that is supposed to be in your gut, if there's overgrowth there, or there's a low commensal bacteria. So I love this test simply because it gives us so much information, and it helps us know exactly how to just really be laser focused in how we support you. Another test that I like to use in conjunction with this is the KBMO food sensitivity test. Both of these tests are test kits that we can actually send to your home. You do the collection and then send your collection of samples to the lab directly. But using this information from both of these tests and putting it with just good basic blood work can give us a really great broad view of what is actually driving your disease process. And then we can get busy on helping you correct that. All right, so let's talk a little bit more about the gut microbiome. So microbiome has been this has sort of been a buzzword, right? But I want to break it apart for you so you know what we're actually talking about. So the microbiome is the dynamic collection of microbes or bacteria in an ecosystem. And in this instance, your intestines. So the human body hosts a variety of different ecosystems called microbiomes, and the gut microbiome refers to bacteria living along the entire digestive tract, which ranges from the mouth to the anus, most of which are located in the intestines. So the gut bacteria serve a variety of purposes. And here's a list of some of the most common. It facilitates the immune system, right? breaks down nutrients for absorption, regulates chemicals that communicate with the brain, which affect mood, memory, and sleep, and regulates hormones to keep the body properly balanced. While every person has a unique gut microbiome, the general population shares some commonalities. In fact, across nations, populations showing varying gut microbiomes, for example, people living in the United States are notably different than the gut microbiomes of people who are living in, say, Japan. Let's talk about dysbiosis. This is a word that you hear thrown around a lot, and I'd like you to really understand what it means. So first of all, we inherit our microbiome from our mothers at birth, right? So you gals that are thinking about having a little one, or moms with little ones, really think about how healthy you are when you're thinking about starting a family and having a baby. Because what you are, like, you get to give this little one a really great chance at life, right? If you are in a really good place when you give birth. So just something to think about. When the good bacteria is, so this is a little bit confusing, and I'll try to make it really simple for you here. When the bad bacteria outnumbers the good, or the good bacteria becomes overgrown, the result is dysbiosis. So dysbiosis can occur at any stage of life and can occur suddenly over time. Sudden imbalances are usually the result of an infection or use of antibiotics, whereas diet, alcohol use, and smoking can create an imbalance over time. Or I would like to really put in here that I'd forgotten earlier is stress, right? Having stress in your life, especially a low level stress response, like all the time, can be really, really damaging to the balance in your gut microbiome. So testing for dysbiosis is not a standard practice for conventional medical practices. However, testing gut bacteria is one of the first steps when you start working with a functional medicine professional. Dysbiosis is typically diagnosed by testing fecal samples. And I talked through kind of the GI map. That's my favorite for this. So common symptoms of gut dysbiosis can include frequent gas, bloating, and belching, loose stools, diarrhea, constipation, or just constantly going back and forth between diarrhea and constipation, acid reflux, unexplained weight gain and or difficult weight loss, irritable bowel syndrome or an irritable bowel disease, anxiety, depression, and or frequent low mood, halitosis, which is chronic bad breath, brain fog, joint pain, skin conditions such as acne, eczema, and psoriasis, low energy and chronic fatigue, diagnosis of an autoimmune condition such as Hashimoto's or rheumatoid arthritis, allergies and food sensitivities, or chronic yeast or fungal infections. So let's talk about this. How do we change this for ourselves? So to heal the gut, it is necessary to regain proper bacteria balance, as beneficial bacteria need to be restored, while problematic bacteria needs to be reduced or eliminated. If there is a high viral load or worms or parasites present, this dynamic will need to be addressed as well. When doing this, improving diet and reducing chronic stress are key factors to consider. Stress can cause inflammation of the gastrointestinal system and make you more susceptible to infection. It's important to find ways to reduce stress while healing dysbiosis. So mind-body practices and exercises are beneficial for stress reduction. And the key is to really find something that you like to do, like dance, yoga, meditation, breathing exercises, you know, cleaning the kitchen floor with a mop and blasting loud music and dancing. You know, it's whatever works for you, right? Refined grains. Let's talk about this a little bit. So keep in mind that the food we eat has the power to heal or destroy gut bacteria. Really hear me on this, because that gut bacteria has, like, the food that you take in that's their food as well. So by changing what you bring in as far as food can really change your gut bacteria, right? So here's some things you can do. Avoid processed white sugar and added sugars, as sugar feeds yeast, and it also feeds some very specific types of bacteria that is not helpful. So sugar can go by many names. So here's some to look out for. Cane sugar, table sugar, high fructose corn syrup or just corn syrup, brown sugar, and glucose. Artificial sweeteners such as aspartame and sucralose negatively affect bacteria in the gut. And when we're in the recovery phase, like really wanting to address gut bacteria, natural sweeteners may also need to be avoided in the initial stages of gut healing. So refined grains also break down into sugar, and these can feed yeast and other bacteria. So when you're really wanting to heal your gut, stay away from those. It's recommended that 70% of the diet come from vegetables, as they contain different types of fiber to feed beneficial bacteria in the gut. Foods to eat more of include lightly steamed vegetables, bone broth, healthy fats like fatty fish, avocado, coconut oil. Now, just if you have a gallbladder and it's working well, these healthy fats are going to feel really good. But if you don't have a gallbladder and fats really cause you pain or discomfort, adding something in as simple as a bile salt supplement can really help with that. Fermented foods like kimchi, sauerkraut, kefir. That is, if you don't have an ulcer, if these foods feel good on your stomach. If you do, if these foods bother your stomach, then that means there's other issues present and we need to address those. Yeah, so let's talk about some foods to not do, right? So chronic inflammation is one of the major causes of pain associated with arthritis. In fact, a number of foods that have been found to increase the body's inflammatory response and should be avoided are sugar, which we always talked about, vegetable oils that are found in mayonnaise, salad dressings, barbecue sauce, crackers, bread, potato chips. These can cause inflammation because the body cannot break them down well. Fried foods. So once again, to the types of oils that the body can't break down. Excuse me, I apologize. Gluten is something that is not going to serve you. Dairy. This is something that's not going to serve you either when you're trying to recover from like arthritis. Artificial additives, saturated fats, processed meats like bacon, hot dogs, bologna, sausage, jerky. One of the reasons these don't work well are because of the additives that are in these meats. Trans fats, usually found in margarine, shortening, baked goods like donuts, cookies, and muffins, non-dairy coffee, creamers, frozen pizza, and frosting. Think about really wanting to eat real food, live food, because fast food, something you get through the drive-through, is generally not going to serve you here either. And then thinking about alcohol, especially beer or wine, can really exacerbate inflammation in the body. So let's talk about detoxing. This is another buzzword that people get all excited about. So detoxing is a great way to rid the body of toxins that are responsible for the inflammatory condition associated with arthritis. And this may be done with a coach by your side, and I'll tell you why. I've had so many clients come in to me with their gut totally wrecked because of doing a detox that harmed them, or doing too many detoxes right together, like just continuing, and their body was never able to recover. So one thing we've done as a company to really support you around this is we offer a very specific detox program that we've curated specifically for this type of disease dynamic. You can check it out on our website, or you can give me a call and I'll get you enrolled. I think it's a 6-week detox program, because the other thing that we see is people do like a 3-day detox or a 7-day detox or something that is so hard on their body and harsh that, you know, the after effects are not what you want. So check it out or give me a call. Poor circulation in the joints can occur with arthritic conditions, which can cause the areas to become clogged with organic waste and toxins. So one of the things you need to do is bring in plenty of pure, clean water to help flush out accumulated waste. For an extra boost, try drinking lemon water with fresh lemon juice or even sliced lemon in the water to really support this detoxification. Let's go to the next slide. I want to talk a little bit about metabolic detoxification. This is something that's deeper. So our functional medicine program incorporates metabolic detoxification and provides nutritional support to facilitate the body's natural pathways involved in the processing and excretion of toxins. This is huge. This is a big root cause. So as I said earlier, this is best done with your coach, who can put together the recommendations that are going to facilitate recovery and not cause harm, because everybody's body is different. So here are some steps that may be included in your program. Reducing and eliminating food triggers. Remember, we were talking about food sensitivities being a big part of this, right? Supporting liver function. This is a big piece. Using clean eating practices to lessen the burden of incoming toxins. Optimizing your gut, liver, and kidney function with phytonutrient-rich foods. We also use quite a bit of supplementation if needed to support the gut, liver, and kidney function. Antioxidants to support detoxification. This is something that for a time we may need to use some supplementation because doing this just with food is sometimes not enough. We would also be encouraging healthy elimination, making sure you have bowel movements every day and making sure those bowel movements are the right type. Balancing hormone metabolism. This is a big one. This is really big. And this can take some time. So let's talk about an elimination diet. A lot of people are trying to do elimination diets on their own. And it's really great if you follow, if you're really disciplined and you follow all the rules and do it right. But this can be pretty hard if you don't know exactly what foods you're looking at. That's why I like to use something like a KBMO food sensitivity test to give us kind of some numbers. But doing an elimination diet may also be needed alongside the KBMO test. So elimination diets are short-term eating plans to eliminate foods causing digestive reactions. And our senior coach, Christy, has put together a program to actually walk you through this process. You can check it out on our website. It's in a do-it-yourself form. So she really lays out all the steps, how to do it, so that there isn't, you know, you're not going, okay, now what do I do, right? And she also is really clear about how to reintroduce those foods and being able to understand what your body's trying to tell you, because that step is usually where people start to get confused. So elimination diets are really beneficial for pinpointing exactly which foods are the culprits for health-related issues. All right, let's talk about supplementation. This is something that so many of us, right? We read something in in an article and we're like, oh yeah, we ought to take this. Or we see something on TV and we think, oh yeah, we ought to take this. And it may or may not be that supplement is something that's going to support you. You may be creating really expensive urine and it's not really doing anything for your body. So that's one of the things that I like to go through clients. Like some people have come in literally with a box or bags of supplements that they're taking. And their body is so overwhelmed that we have to really peel away and figure out what supplements are really serving their intention of becoming well and really supporting their body, and which symptoms are just not. All right. So supplements can be really useful for returning gut microbiome to normal and for reducing pain associated with arthritis conditions. But choosing which supplements are right for you and which ones will not support you needs to be done with you and your coach, just sitting down and just really working through that. If you're wondering what is best for you, please book in with one of our senior coaches and we'll go through this with you. Looking at what your disease process is, what you've done, what's worked, what hasn't worked, and then we'll be able to really help you understand what supplements can be the most helpful for you. So our philosophy here at Sagebrush is that when the body is in good working order and you're prioritizing an environment of healing, you will need very few supplements to support your continued wellness. And we can help you get to this level of wellness. When we get this piece right, you may be able to lower the dosage or eliminate prescription medications. So a lot of times when people come in, that will be one of their goals. They want to get off their meds because they don't like how they feel on the meds. So what we do with that is we really help address the root cause, why you're even needing those meds, right? And when we get your body to the place where you don't need them anymore, then it's time for you to go back to your prescribing physician and figure out a plan for reducing or eliminating the medications safely. All right, let's talk about some herbal therapies. And this is really big, especially for do-it-yourselfers, right? We always want to really facilitate our own healing. And that's just a natural, inborn, very beautiful part of us. And we need that, right? So I want to go through some therapies that are really helpful. So ginger root actually is known to improve joint pain and reduce inflammation for people with osteoarthritis and rheumatoid arthritis. And one of the main ways that it does that is it really supports cleansing in the liver and gallbladder, but especially the liver, and it's anti-inflammatory. Turmeric. This is also something that is really helpful. My favorite form of this would be Mariva. It is it's turmeric that has been broken down to the simplest form, and it's really easy for your body to uptake. So Mariva is my favorite of those. This really helps to stop or really address the inflammation in the joints and helps with edema or swelling. And it can really support slowing joint destruction while we figure out what the root causes are and really address those. So frankincense. Frankincense is really helpful for reducing inflammation and pain. So just massage this oil directly into the painful areas to help reduce inflammation. I would really suggest that you cut it a little bit with some fractionated coconut oil, just to make sure it doesn't irritate your skin. Comfrey can be added to topical creams to help with pain for arthritis. Burdock root is really delicious, added to like stir fries. This is also something you could take in a tea, and it can help with it's an anti-inflammatory herb. Stinging nettle is an amazing herb for all types of arthritis and gout. It has anti-inflammatory benefits, plus it's packed with really great minerals like boron, calcium, magnesium, and silicon to ease the pain while helping to build stronger bones. Stinging nettle can also be, I think you can get that in a tea or a tincture. That can be really helpful. Licorice is a really useful, I like to use deglycerized licorice, especially if you're looking for it in a supplement form. Deglycerized licorice is going to be much easier on your stomach. So these are just some things to think about that can really support, like especially with pain management while we're working on figuring out what the root causes are for you. So I want to tell you thank you. Oh my goodness. I appreciate that you all have come and are taking the time to experience this class with us today. As I was saying earlier, we're accepting new clients, one-on-one clients, as well as enrolling clients into our group coaching program. That's the whole body rejuvenation program that is designed specifically to help with all of the conditions we cover today. So to enroll in our group coaching program, go to sagebrushwellness.com and click on the 12-week program. There's a really great video that I've created for you that goes into detail about the course, and just click the button at the bottom of the page to pay and enroll. We are so very excited for you to join us. This is going to be fun. And as you can tell, we certainly love sharing natural ways to aid the body's own healing process. So if you have any further questions, book in for a free discovery call with me. To do that, you can go to sagebrushwellness.com and use the book a session button on the homepage, or you can use the link that is on your screen right now, the Calendly link. So have an absolutely amazing day, and we'll see you soon.